Hello, Partnering for Vaccine Equity Learning community members and others working on vaccine equity. Welcome to this afternoon's event. My name is Jenny Haley, and on behalf of our team at the Urban Institute, thank you so much for joining us. Today, we're going to hear from two great speakers who will provide an overview of flu and COVID-19 diseases and vaccines. And they're going to explain why being vaccinated in flu season is so important, which is especially timely given where we are in the season right now. And they're also going to provide some updates on vaccines and boosters, which will be extremely helpful as the guidance has been evolving really quickly these days. Before we go further, we'll do a quick review of how the session will work. So as you can see on this slide, you've been muted upon entry into the session. There are a lot of us, so staying on mute unless you're speaking is key to keeping the discussion going without accidental interruptions, so thank you. After the presentations, we will reserve some time for Q&A. If you would like to type your question, you can use the Q&A tab to do this, and you can ask a question at any point during the session. And if you would prefer to speak your question rather than type it into the Q&A, that's fine, it's your choice. All you need to do is use the raise hand feature during the Q&A, and we will unmute you. The chat room feature is also open today, and we absolutely encourage you to chat amongst yourselves. But please remember to use good chat room etiquette. We don't recommend that you post questions for the speakers in the chat, just because there's a chance we might not see them there. The Q&A would be better for that. This goes without saying, I'm sure, but of course be civil to one another and to our speakers while you're chatting. And as with all of our learning events, we will post the slides and a recording of this event on our community website, and we'll circulate them through the digests that go out through the CDC managed adult vax program listserv, and all of our program members should be a part of that. If you have technical difficulties at any point during the session, you can send an email to our community manager's inbox. That's vaxequitylearning@urban.org. We'll be watching the inbox, and we'll try to help you as quickly as we can. We're also excited that we're beginning to offer live interpretation from English to Spanish during our events. So at some point later in the webinar, you may see a globe icon on the Zoom taskbar at the bottom of the screen, and that's how you can select the Spanish language channel. So I'm going to go ahead and introduce you to our featured speakers so that we can get started. First, Dr. Yabo Beysolow is a pediatrician with over 20 years of experience in private practice in urgent care settings. She's also a public health professional with several years of work experience at the CDC in the Immunization Services Division. Since 2020, she has served as an educator and chair of the EPIC Immunization Program for the Georgia chapter of the American Academy of Pediatrics, educating healthcare providers across the state of Georgia. Dr. Yabo is also a wife and a mother and actively involved with the wellness ministry in her church. She organized and led multiple medical mission trips to Liberia and Angola to provide free health services. Lisa Jacques-Carroll is an independent consultant with 20 years of immunization experience working at the state, national, and international levels. She began her career in Michigan's immunization program and later spent 6 years coordinating the CDC's perinatal hepatitis B prevention program. She was a consultant to the World Health Organization, providing technical assistance to other countries on the introduction of new vaccines. And she later worked for CDC's Global Immunization Division, coordinating the activities of the CDC and various partner agencies and organizations. Her last CDC assignment was as Deputy Program Manager for New Mexico's immunization program. She currently consults for the Association for Immunization Managers, or AIM, Immunization Action Coalition, the Coalition for Global Hepatitis Elimination and Task Force for Global Health, and the World Health Organization. Both Dr. Yabo and Lisa currently serve as immunization subject matter experts working with AIM and CDC's REACH program to provide guidance and expertise on increasing influenza and COVID-19 vaccination rates in racial and ethnic groups experiencing disparities in vaccination rates. AIM and REACH are part of the Partnering for Vaccine Equity community, and I know that some of you who are joining us today are from AIM or REACH, and you're probably already familiar with the great work that these speakers are doing. So I'd like to conclude by saying thank you so much, both of you, for joining us. And Lisa, I will hand things off to you now.
Thank you, Jenny. Thank you for the warm introduction. And if we could have the next slide, I think we could get started. And as Jenny mentioned, today we will provide an overview of flu and COVID-19 disease and vaccines. And thank you all for joining us. Next slide, please. Next slide. So the topics that will be covered during this session include flu disease basics, racial and ethnic disparities in both flu disease and flu vaccination, flu vaccine basics and myth busting. And then we'll cover the similarities and differences between COVID-19 and flu. And then there's COVID-19 vaccine updates, including booster doses. And we'll leave time at the end for questions. Thank you. Next slide. So let's start by looking at flu basics. Next slide, please. So what is the flu? Influenza is a virus known as the flu, and it is spread from person to person, and it infects the nose, throat, and the lungs. Next slide, please. The burden of influenza disease in the United States can vary widely and is determined by a number of factors, including the characteristics of circulating viruses, the timing of the flu season, how well the vaccines are working to protect against illness, and how many people get vaccinated each year. And while the impact of flu varies, it places a substantial burden on the health of people in the United States each year, as well as the healthcare system. CDC estimates that from 2010 to 2020, influenza has caused between 9 million to 41 million illnesses, 140,000 to 710,000 hospitalizations, and between 12,000 and 52,000 deaths each year. Next slide, please. So here are some common symptoms of the flu. Fever or feeling feverish or with chills, but not everyone with the flu will have a fever. Cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, which is feeling tired. And though some people may have vomiting and diarrhea with the flu, this is much more common in children than adults. Next slide, please. So the flu is spread when a person who has influenza coughs, sneezes, or speaks, which spreads the virus into the air where other people can breathe it in. When the flu virus enters the nose, throat, or lungs of the person, they begin to multiply and cause disease. The virus can also be spread from touching a surface with the flu virus on it and then touching your nose or your mouth. And people can spread the flu before they feel sick and while they feel sick. Next slide, please. So this slide has a list of the health and age factors that are known to increase the risk of serious complications from the flu. And then the next slide is actually a continuation of these medical conditions. Next slide, please. So this infographic shows the similarities and differences between the flu and the common cold. So you can see that with a cold, fever is rare, but that's actually a pretty common symptom with someone who has the flu. And then with cold, things like sneezing, stuffy nose, and sore throat are common, but those are less commonly experienced when you have the flu. Next slide. And this is an infographic on the differences between the flu and a cold in Spanish that was developed by AIM for iREACH, the iREACH project. Next slide, please. And this infographic shows the differences between flu and COVID-19 disease. You can see that many of the symptoms are similar, but loss of taste and smell and shortness of breath are more common with COVID-19 than with the flu. Next slide, please. So how do we prevent the flu? So the best way to prevent the flu is to take time to get a flu vaccine. And there are other everyday healthy actions that you can take in addition to that. by avoiding contact with people who are sick and staying home when you are sick yourself, covering your mouth and nose with a tissue when coughing or sneezing, washing your hands often with soap and water for at least 20 seconds, or using hand sanitizer that is at least 60% alcohol if soap is not available. Avoid touching your eyes, nose, or mouth, and to get plenty of sleep and clean and disinfect frequently touched surfaces, drink lots of fluids, and eat healthy foods. Next slide, please. So there is treatment for the flu. If you get sick with the flu, your doctor may ask you to take antiviral drugs. And antiviral drugs can lessen symptoms and shorten the time that you're sick. So contact your doctor right away if you're high risk for flu complications and think that you have the flu, because you should start antivirals soon after you become sick, within 2 days if possible. And also please note that you would need a prescription from a provider for antivirals. Next slide, please. Now let's talk a little bit about racial and ethnic disparities in influenza disease and vaccination. Next slide. So people from racial and ethnic minority groups, such as non-Hispanic Black persons, non-Hispanic American Indian and Alaskan Native, and Hispanic and Latino persons, are at higher risk for being hospitalized with the flu. And we also know that people in racial and ethnic minority groups are less likely to get a flu vaccine than non-Hispanic white persons. Next slide, please. So this CDC graph shows flu-related hospitalizations by race and ethnicity from the 2009, 2010 through the 2018, 2019 flu seasons. And you can see here that non-Hispanic Black people had the highest hospitalization rates, followed by non-Hispanic American Indian or Alaskan Native people, and then Hispanic or Latino people. Next slide, please. And for the most recent season, prior to the onset of the COVID-19 pandemic, we saw that the overall flu vaccination coverage was 48% in the US. But as we have seen for decades now, there are still disparities by race and ethnicity, with African American, Hispanic, and American Indian, Alaska Native populations being vaccinated less than their white peers. So we know that we still have work to do every year to try to eliminate these disparities in flu coverage. Next slide, please. Now we'll talk about flu vaccines. Next slide. So seasonal flu vaccines are designed to protect against the influenza viruses that research indicates will be the most commonly circulating during the upcoming flu season. So this year, all the flu vaccines in the United States are quadrivalent vaccines, which means that they protect against 4 different flu viruses. So CDC recommends the use of any licensed age-appropriate influenza vaccine during the current influenza season. And the available influenza vaccines include inactivated influenza vaccines, recombinant influenza vaccines, or the live attenuated influenza vaccine. And no preference is expressed for any influenza vaccine over another, but we do know that only certain people are eligible for the live attenuated intranasal flu vaccine. Next slide, please. Now let's talk about the importance of older adults receiving flu vaccine each year. There's an increased risk for severe flu disease in older adults, and vaccines are in general less effective in this age group due to waning immune response in this population. So any of the currently available injectable flu vaccines are approved for this age group, but not the nasal flu spray. But there are 2 vaccines that are approved specifically for people 65 years of age or older. And that's the adjuvanted inactivated flu vaccine and the high dose flu vaccine. And so these are vaccines that are meant to boost the immune response in older adults for the flu vaccine. And ACIP and CDC do not make a preferential recommendation for any one vaccine for any age group, but just that these vaccines are available for this specific age group. Next slide, please. So a common question about flu vaccine: how quickly does a flu vaccine work? Does it work right away? And the answer is no. It takes about 2 weeks after vaccination for antibodies to develop in the body to provide protection against influenza virus infection. And that's why it's best to get vaccinated before flu virus starts to spread in your community, ideally in September and October. Next slide, please. So other people have asked, does the flu vaccine protect me against COVID-19? And the answer is no. The flu vaccines are not designed to protect against COVID-19. Flu vaccination reduced the risk of flu illness, hospitalization, and death, in addition to other important benefits. But getting a COVID-19 vaccine is the best protection against COVID-19. And again, COVID-19 vaccines will not protect you against flu. You need to get both vaccines for adequate protection. And you can visit CDC's frequently asked questions for more information. Next slide, please. And now I'm going to turn it over to Dr. Yabo. Thank you.
Thank you so much, Lisa. That was an excellent overview of flu disease, flu vaccines, and just giving everyone a basic starting point as we move forward in the discussion. And it also reminds us of all the work that all of us have to do in our organizations to promote flu vaccination as well as COVID vaccination for our racial, ethnic, minority communities. So with that, we'll try to bust some of the myths that have existed for years about flu vaccine. Next slide, please. One of the more common ones that we hear often is, well, the flu vaccine can give me the flu. I really do not want to take that vaccine. And the simple answer is no, you cannot get the flu from the flu vaccine. As Lisa mentioned, the flu vaccine is either inactivated, meaning killed, or weakened, the live nasal spray, which is weakened. What that really means is that when the vaccine manufacturers are making the vaccine, they actually take the flu virus germ and they either kill it by heat or by chemicals, or weaken it to such an extent that once it's injected into your body, it can no longer function as a virus. So in that weakened or killed state, the vaccine gets into your body through injection or through the nasal spray. Your body sees it as something foreign. It doesn't know that it's not the real germ. And it develops what we call antibodies or protective cells to fight off these germs. In the future, if you actually come into contact with the real flu, your body has remembered that. It has those memory cells still sticking around, and it will basically kill off and protect you from the actual flu virus. So in a nutshell, that's how these vaccines work. So again, remember, you cannot get the flu from the flu vaccine. The symptoms you may have after a flu vaccine, such as soreness, redness at the injection site, etc., those are all signs of your immune system working to do what it's supposed to do. It's supposed to kill off the germ, make sure that it's not infecting your body. And so those are just all signs of an immune system functioning. Next slide, please. Another myth we hear often is that healthy people do not need the vaccine, and we want to share this video with you.
My name is Emily Vera. I'm from the Skeetcheston Indian Reserve.
I've always said, you know, that one of the most important things to me is family.
I think it's important that my children get vaccinated.
These are my great-grandchildren that are here today.
Grandma Emily takes me to get my flu shot and her too.
I know I had a sister when we were all young, and she passed away from the flu that went around that year. My mother was cooking supper and she told me to lay down with my sister, so I did. And then when I got up, I told Mom, she's really cold, you better go check her. So Mom went and checked her, but because we didn't get her shot, she had passed away. So it's really bothered me a lot.
These diseases can kill people. Influenza is a huge one that we give annually, and everybody who is eligible should get their flu shot. Campaigns on vaccinations are important, not only for First Nations communities, all communities, because if we don't keep the vaccination programs going, people will forget. They won't be proactive in protecting their families.
When I was pregnant, it was flu season, so I was kind of freaking out, trying to figure out what I should do. I definitely was told that it was very important, being pregnant, that I should get my shot in flu season, so that's what I did.
Quemshine Health Society, in the past, the community health rep has left flyers door to door, letting people know when our flu clinics are running.
With Easton, I'm really lucky that we can work with QHS because they are definitely going to help keep on top of all these immunizations.
I get every flu shot. I've been getting it for years and years, and I never get the flu. Immunization is very, very important. And
Thank you for sharing that video with everyone. So answer that question, I hope, for you. Yes, we always talk a lot about people with underlying medical conditions, as Lisa showed on one of her slides, people with heart disease, diabetes, kidney disease, et cetera, being at higher risk for complications from the flu. But we also know that healthy people can also get very sick from the flu and can die from the flu. So very important that we dispel this myth in our communities. Next slide, please. Another myth we hear is, I got a flu shot last year. I really do not need to get another one this year. I'm still protected. That is a myth. The flu vaccine is basically developed every year based on predictions of the viruses that may be circulating for the upcoming season. So in a nutshell, in January or February of every year, scientists around the world talk to one another and say, this is what we're seeing, this part of the world, these are the viruses that are circulating. That information is then used by vaccine manufacturers later in the spring, summer to start developing flu vaccine for the fall, winter season in the US. And it changes from year to year. The flu viruses that are used to make 1 year's vaccine are different from the one prior in most cases. And so it's important that you get the flu vaccine for that particular season. Next slide, please. We often hear later in the course of the flu season, say maybe January, February, flu season's done, it's too late to get a flu shot. What studies have shown us year after year is that flu season can peak anytime between December and March. And so there's still an opportunity to get your flu vaccine through March and even sometimes as late as May. And so it's never too late in the flu season to get vaccinated. As Lisa mentioned, it can take 2 weeks after flu vaccination to actually be protected from the flu. So you want to get your flu vaccine early. With the holidays coming up, we're going to be gathering with family and friends. This is the perfect time to go ahead and get your flu vaccine. Next slide. And we hear this one a lot, don't we? I got the flu vaccine and I still got the flu last year. Well, there's so many reasons why we can dispel this myth, and I'll just go over a few of them. One is that there's so many germs that circulate during this time of the year. During flu season, you can have the common cold circulating, which is a different virus from the flu. You can have another virus called RSV that we see a lot of the kids have had this year, which gives them a really bad cold. You can have so many different germs, and they're not all the flu, but a lot of times people mistake them for the flu because they can feel just as bad with those germs. And so just because you come down ill with something, it doesn't necessarily mean you have the flu. The only way to know for sure is to get tested. Another way you can dispel this myth is that it can take up to 2 weeks for the vaccine to provide protection. So if you're vaccinated today and then tomorrow, the next day, you come into contact with somebody who has the flu, you could still catch the flu while your body is still developing protection from vaccination. We also know that the flu vaccine contains this year 4 strains of the flu virus that have been killed or weakened. And so the flu, nothing's 100% effective, nothing's 100% perfect. So you may come down with one of the strains in the vaccine that's supposed to protect you. However, you're still protected against the other 3 strains. So remember, again, these vaccines contain the killed or inactivated strains of the virus, the flu virus, and they're trying to protect you from all the strains. We also know that the flu season can be lengthy, it can be months, and your immunity from the flu vaccine can start to wane over time. And so these are some of the reasons why someone may still get the flu even though they've had the flu vaccine. Next slide, please. And another one, the flu vaccine doesn't even work. Again, a myth, because we know that flu vaccinations really prevent, especially pre-pandemic, flu vaccines prevent millions of illnesses, hundreds, thousands of hospitalizations, and thousands of deaths every year. And over the last year, we've gotten a false sense of security because we were wearing masks during the COVID-19 pandemic. We were still at home, we were social distancing, but we still have to be vigilant as we start to come together again, as people are not wearing their masks without vaccination for the flu. You're really an easy target. So we really encourage you to go ahead and get your flu vaccine. Next slide. So now we'll talk a little bit about flu and COVID-19 diseases and the vaccines and how they're similar, how they're different, and how we have opportunities to develop co-messaging around both of these illnesses as well as the vaccines to protect against them. Next slide, thank you. So this is really just a comparison table. And what we see with flu and COVID-19, the complications may be slightly different with flu. You may have ear infections, sinus infections, and pneumonia. Whereas with COVID-19, you can also develop more serious complications like blood clots, something called MIS-C, which is a multi-system inflammatory condition that we see in children, where they also may develop blood clots or heart conditions. And you may also develop long COVID where you have persistent fatigue or brain fog, complications with your other major organs. What are the similarities between the two? Is that both of them can impact someone who has an underlying health condition like asthma, heart disease, or diabetes. In all those instances, what happens is that you may be doing very well with your asthma or heart disease. They're pretty much under control. But then unfortunately, if you come down with either the flu or COVID, both of those now affect your breathing or your respiratory system and can cause all those illnesses, the asthma, heart disease, to basically be out of whack. And now you're in the hospital with complications of your asthma, heart disease, in addition to having COVID or the flu. We also know what's similar about the two illnesses is that both of them may require hospitalization and both can unfortunately be deadly. Everyone is at high risk for complications, healthy or not. And luckily we do have vaccines now available for both diseases. Next slide. We also want to remind everyone about warning signs to watch out for. These are things that you really do not want to sit home and wait it out. Really, there are testing sites available now for both flu and COVID in many communities, and it's so important to seek help early. And we'll share with you why you need to do that in a little bit when we talk about COVID-19 and how you can treat that. Lisa also mentioned with flu, if you were to catch the flu, you can get something called antivirals. Those are medications that if you take them early on during the course of the illness, it really halts the progression of the illness. You feel better a lot faster and it decreases your chances of being hospitalized. Same thing with COVID-19. So you really do not want to wait until these emergency warning signs start showing up. But if they do, please seek help immediately. And you see them all here on the screen. I'll just point out a few: difficulty breathing or persistent chest pain or shortness of breath, severe weakness, you cannot stand up straight, you're very unsteady. And then one that is tricky is you had fever or cough, it got better, but then a day or two later, it got worse again. That can be a very serious warning sign. Next slide, please. And can you have both infections at the same time? Unfortunately, yes, you may have both of them at the same time. And again, because the symptoms are so similar, it's hard to tell the difference between the two. That's where testing comes into play. And there are some facilities now that will do a test with one swab, where you can test for both COVID-19 and flu based on one swab. And on the next slide, we're sharing there again an infographic that was developed by AIM for the iREACH program, and going over what I just shared as far as similarities and differences between flu and COVID-19, and really encouraging your communities to get vaccine for both diseases. Next slide, please. Very similar to the slide that Lisa showed before for flu disease. These are some of the very same underlying medical conditions that may increase someone's severity of COVID-19 disease, such as cancer, Down syndrome, heart conditions, if someone's immunocompromised, if they're pregnant, if they're overweight. All of these may increase your severity of COVID-19 disease. Next slide. And what do we have in our tool belts? Well, we have vaccines. We have the flu vaccine, and that is now recommended for everyone aged 6 months and older, with very rare exceptions. And there are some people who are prioritized every year to get the flu vaccine, especially those who are at increased risk, like we mentioned, someone with underlying medical conditions, our older adults, et cetera. With COVID-19 vaccine, we can now say that everyone ages 5 years and older without contraindication is eligible to get a COVID-19 vaccine. And initially, we know these vaccines were prioritized for certain people in the population, but now that there's adequate vaccine supplies, everyone is eligible to receive a vaccine. And Pfizer can be given to persons 5 years and older. There are different formulations based on the age group. Moderna and J&J for 18 years and older. Next slide. Pregnant people, we wanted to pause here and just emphasize the importance of vaccinating pregnant people, because both illnesses can be extremely detrimental to someone who's pregnant. Whether it's flu or COVID-19, that person could end up hospitalized in the ICU on the ventilator just because they're carrying another human. And so they're just at increased risk. There's so much stress on their bodies. So increased risk from both of these illnesses. We do want to report CDC recommendations stating that you may receive either the flu vaccine or COVID-19 vaccine in any trimester of pregnancy. These have both been tested, have been found to be safe. With the COVID-19 vaccine, we know there have been some concerns from the public about doing this during pregnancy, but studies have shown throughout the pandemic that it will not affect you being able to become pregnant. It does not affect fertility. People who've received the vaccine still have become pregnant and are going through very normal pregnancies. We also know it has not increased the rate of miscarriages, nor has it increased the risk of any pregnancy complications by getting your COVID-19 vaccine during pregnancy. Same thing with flu vaccine. It's been used for years in people who are pregnant, and we have not seen an increased risk with that either. We do want to remind practitioners not to give the nasal spray live flu vaccine to pregnant people. And we also are happy to report that both of the vaccines protects not only the pregnant person, but will also protect the unborn baby and infant. Flu vaccine will provide protection for up to 6 months after birth for the infant by giving it to the mom. That passes through onto the infant. And we know that that's so important because infants are not eligible for a flu vaccine until they're 6 months old. So we're basically cocooning by providing protection of the pregnant person and the spouse and all the family members, getting them vaccinated to protect that newborn. We're also learning that COVID-19 vaccines given to a pregnant person may also provide that same protection. We don't know for how long, but that's still being studied as well. Next slide. And yes, this was a question that already came through the Q&A. Yes, you may administer both vaccines on the same day. What we do recommend is that perhaps have one vaccine in one arm, one in the other, because both vaccines have increased risk of local swelling or redness. These are expected side effects. Remember, I mentioned when your immune system's working, showing that it's working, one of the signs, not always, but one of the signs is that it will show your body's trying to fight off the infection by mounting a fever. And also You may have redness or swelling at the injection site. These are all expected. So to avoid that happening in the same arm from both vaccines being in the same arm, we would recommend the flu vaccine on one arm and the COVID-19 vaccine in the other, if at all possible. And the COVID-19 vaccine right now can be given with any other vaccine on the same day. It's not only with the flu. Next slide, please. Twindemic, we heard about this a lot last year, and that phrase is coming back. Unfortunately, we are concerned again that we may have increasing COVID-19 cases as we enter flu season. And then what happens if we have so many flu cases developing at the same time and have this, what we call twindemic, both of them going on at the same time. And so the best way to prevent this is vaccination. And we already mentioned you can get both vaccines at the same visit if eligible. Next slide. So just a few vaccine updates. You've heard a lot in the news about booster doses, so we'll switch over to that. And before we talk about booster doses, we want you to remember that, again, you have many tools in your tool belt to fight COVID-19 disease. You have the vaccines, which are there to prevent the disease. They will not treat the disease if you already have it. They're to prevent the disease. But you also have what are called therapeutics. These are medications or therapies that can be given to someone who has become infected with COVID-19, preferably earlier on in their illness, and they will help your body fight the infection by boosting your immune response. They will help keep you out of the hospital. These are things like monoclonal antibodies, some antivirals, convalescent plasma, or steroids. Sometimes you may still be in the hospital in the early stages and you may be eligible, but usually, again, these are therapies that are reserved for someone earlier on in the course of illness. And that's why it's so important if you start having symptoms to seek help early and not to wait when these medicines may not be of benefit to you. Please be aware of using therapies that are not approved or authorized by the FDA, such as ivermectin, which is used as horse serum, and that is not approved or authorized by the FDA. Next slide, please. So before we talk about booster doses, we wanted to clarify there are two definitions here. What's an additional dose? What's a booster dose? An additional dose in terms of COVID-19 vaccine has been described as a dose that's given to someone who is either moderately or severely immunocompromised. Their immune system just does not work as well because of their underlying illness, say they have active cancer. And so because of that, when you give them their 2-dose series of either Pfizer or Moderna, those vaccines may not have taken as well into their system because their immune systems were just not working as well. And so to provide them that optimal protection, they are recommended to get a 3rd dose. So it'll be a 3rd dose of Pfizer or a 3rd dose of Moderna. That becomes part of their primary series. Those people are still eligible 6 months later for a booster dose, so a total of 4 doses. Now, difference here is that a booster shot is administered for anyone healthy, just anyone in general who's completed their vaccine series. But what happens is that over time, we know that that protection has started to wane. We've seen it in studies with all 3 vaccines, Pfizer, Moderna, and J&J. And so you need a boost, you need a jump start to your system to have your immune system start really protecting you again. And that's what the difference is between boosters and additional doses. So on the next slide, it's just a quick infographic, just sharing who needs that 3rd dose, who are the people who are severely immunocompromised, and that includes someone with advanced or untreated HIV infection, someone who's receiving active cancer treatment for tumors or cancers of the blood, etc. On the next slide, we talk about booster doses, and we want to just kind of share with you the overview. Basically, CDC and the FDA have recommended that everyone, let's start with the J&J vaccine. Everyone who received the J&J vaccine, they're 18 years and older, they can go ahead and receive a booster of any of the vaccines 2 months later. So you got your J&J vaccine, 2 months later, you can receive your booster of any of the other vaccines as long as you're 18 and older. For the Pfizer and Moderna vaccines, though booster doses for those are recommended 6 months after completing your initial series. And is recommended for people who are 65 and older, those who are 18 and older who either live in a long-term care setting, that can be like an assisted living or nursing home, et cetera. Someone who has one of those underlying medical conditions. And then someone who works or lives in a high-risk setting, such as they may work in a healthcare facility. They may work in the essential worker positions, such as interacting with the general public on a more frequent basis than others. So those are all the people who are eligible to receive a booster dose of either Pfizer, Moderna, or J&J vaccine 6 months after completion of their series. So again, mix and matching dosing for booster shots is allowed. So next slide, please. So you probably hear my son in the background. I'm going to ask him to be quiet, but the Braves won, right? The World Series. So all the kids in Georgia have no school tomorrow. And I promise you, I told this young man, please do not scream in the middle of my presentation. So let me keep on going.
Do you want me to take over, Dr. Yabo?
I'm good. He stopped.
Okay.
So this is real life. So who's eligible for a booster shot? So this is another infographic, just summarizing what I mentioned. Who's recommended on the left-hand side, Pfizer, Moderna, and then on the right, J&J, and it can be a mix and match. So that in a nutshell is, the booster shot recommendations. I know we may have more questions shortly. So next slide. So what are some of those frequently asked questions? Will booster shots be the same formulation as existing vaccines? They are the same with the exception of the Moderna vaccine. During the studies of the booster dosing for Moderna, it was found that it would be half the dose of the regular vaccine. Half the dose provided the same amount of protection and had decreased side effects. And so half of the dose of the standard or primary series was chosen for the booster. But for Pfizer and J&J, it is the same dose as you would have received during the primary series. The booster shot should also be free, like the initial vaccine series. And we get a lot of questions about this because people sometimes are asked to present their insurance cards when they go. And that is usually used by the facility that provides the vaccine to cover costs for hiring staff or the supplies they may need, et cetera. But you should not be receiving a back bill, meaning after you leave, you get a bill saying, you owe such and such amount. So please make sure that you are noting this and reporting this if you're hearing about this in your communities. And does the change of fully vaccinated change when we talk about booster shots? No. Fully vaccinated still means that you received your primary series of either Pfizer or Moderna, the 2-dose series of either of those, and 2 weeks later, you're considered fully vaccinated. Or if you receive the J&J vaccine and 2 weeks later, you're considered fully vaccinated. Next slide. And do you have to basically prove that you're eligible to receive a booster shot? No, you do not. You can basically self-report that you're eligible based on the conditions, underlying medical conditions, or working in a high risk or living in a high risk situation, et cetera. Where will boosters be available? Pretty much every pharmacy or physician's office should now have them. And you can also go to vaccines.gov to locate vaccine in your area. And we already mentioned, yes, it is safe to administer COVID vaccine with other vaccines like the flu vaccine. Next slide. So we're at the point of questions. So we have a good 15 minutes. So Lisa and I are available now to answer any questions. And thank you all so much for your attention.
We do have one in the Q&A box, Dr. Yabo. It says the Pfizer COVID-19 vaccine has been fully approved by the FDA. Moderna and J&J are still only approved under emergency use authorization. Is there any news on Moderna and/or J&J COVID-19 vaccines becoming fully approved by the FDA? So that one, I haven't looked at the status lately, but I think they're still working on their clinical trials to complete their clinical trials and have enough data ready to submit to the FDA for their full approval. But Dr. Yabo, do you know anything more about that?
No, so just still in the wait, in the waiting wings, waiting to submit all that data.
Mhm.
That's correct. And then I see another one is the Pfizer booster vaccine, a full or half dose. It's a full dose. So everything is a full dose booster wise, except for Moderna, which is a half dose of the primary series.
And then the next question, has a decision been made about recommending annual COVID-19 vaccination moving forward? And that is still up in the air. We really don't know. And there will continue to be data gathered on people's immunity and breakthrough infections, and all of that information going forward will inform whether or not we need to have additional boosters later on.
Exactly.
Thank you for your great questions. How
Right.
do we convince patients to get boosters? What would you say to them to encourage them? Oh boy.
I would start with just reminding them that other vaccines require boosters, like your tetanus vaccine. You have to get that every 10 years. With children, for example, they start getting vaccines at 2 months, 4 months, 6 months. They get boosters at 4 years, again, when they turn 11. So vaccine protection wears out over time. This is nothing new with COVID-19. So we really encourage you to get a booster, protect yourself, because we really do not know how long protection lasts. The antibody tests that are out there now are good to detect whether you had a past infection, but they in no way can predict how long that protection lasts.
Great. And then the next question is, what are the great presentations? What are the best sources of data on flu vaccination rates by county, race, and age, or other available demographics? We do have flu vax view from CDC, but that is at the state level, I believe, not at the county level. I'm trying to think, Dr. Yabo, do you know of data? I mean, I think probably your state health department would be the best place to go and see if they can run your county data through the immunization registry for
That's
flu
right.
vaccination. That's probably the best source of data for that.
Yes, and I'm just typing those in for you. So flu vax view, like you mentioned, through CDC, and then your state immunization data, they'll have more local. Exactly right.
Okay, and then another question similar to the one before, will we have to be vaccinated for COVID-19 yearly? And we just don't know the answer to that quite yet. And I think we just need to wait and see what the data shows. And if the COVID-19 virus continues to, change like we had with the Delta variant, or if it sort of stays the same, and then just how long, even after these booster doses, how long that immunity stays strong. So we'll just have to wait and see for more data on that before we know. Do you have anything more, Dr. Yabo?
No, but perfect. I think you asked a question that came through the chat. Someone asked the follow-up question to that, how long will protection from the boosters last? And again, only time will tell. And that's how we came to the realization of when to even give a booster, 6 months or later. It was over time after the scientists who manufacture these vaccines, as well as the FDA, continue to look at people who've been vaccinated month after month and looking at how much protection they had, where they're breakthrough cases. So we're going to continue to do the same with the booster shots to see how long that protection lasts.
And then we have a question from Laura. She says, thank you for this presentation. Her question is, what about the message of getting vaccinated now so you can create a safer environment for the holidays? Is that an accurate message we could get out there? I think it might help motivate our patient population, but I don't want to create a false sense of security. I think it's kind of complicated because we're talking about two different vaccine or two different viruses, right? The flu and COVID, which could both potentially be an issue during our upcoming holiday season. But I think that, getting both of those vaccines will provide a level of protection and would definitely create a safer environment for the holidays if everyone in the family is vaccinated. But Dr. Yabo, what do you think?
Yeah, I definitely think that's my mantra. That's what I'm saying to my family members. Hey, get vaccinated for both, or we all meet up for the holidays. No, but I think that's a great message. I don't think you'll be creating any false sense of security. I mean, we just don't know when flu season will hit, and it's best to get vaccinated now. Yeah. And then restating the reason why someone who has received a flu vaccine but can still contract the flu. So a couple of reasons there. One, remember, again, it can take up to 2 weeks for you to get protection after being vaccinated. So during that time that your body is still working up that protection, you could come in contact with someone with the flu and then get the flu. So that's one way. Another way is that nothing's 100% protective or effective, not even vaccines. And so remember, there are 4 strains that you're trying to protect against when you get a flu vaccine, and you may still contract one of them or come down with one of them even after you're vaccinated, but you're still protected against the other 3. Another reason is that there's so many cold or respiratory germs that look like or mimic the flu out there. And so you may come down with one of these and you may think you have the flu, but it's not necessarily flu. And then over time, over the course of the flu season, if you say you got your flu vaccine in September or October, it may start to wean towards the end of the flu season, like April, May, and you could come down with the flu again then as well. So those are some of the reasons.
Thank you, Dr. Yabo. I will try to take the next one from Linda. Linda says she loves the infographics. Where do we find those for use in the community? And I think that might be something that we'll have to talk with Urban Institutes about after the webinar, because we do have a slide set that we used this week actually during a different meeting with the iREACH recipients that has links to loads of great flu and COVID resources that maybe could be shared after the call. So we'll see about that because a lot of them come from different partners like Vaccinate Your Family or Families Fighting Flu and CDC. So there's a lot of partners out there that put together really great communication materials that I'm sure you all would love to see. And you're on mute, Dr. Yabo.
Sorry, what would be the best messaging to encourage parents to vaccinate their children ages 5 and up? What I would start with is letting parents know that, yes, COVID-19 disease occurs mostly in adults, but it does occur in children as well. We're seeing it. Unfortunately, there have been millions of children who have contracted COVID over the course of the pandemic, and we've seen several deaths in children from COVID. We also see children who are hospitalized because of COVID. And again, not as huge numbers, but every child death is a tragedy. It's a preventable tragedy. We also see kids who develop that multi-system inflammatory condition called MISC after they get COVID, where they can develop heart conditions, blood clots. And so COVID can be very serious. They can also have long-term COVID in kids with brain fog, et cetera. So really, our goal is to protect our children. We give them other vaccines. So I would start with that messaging. This vaccine for 5 to 11s was tested in over 3,000 kids. It was found to be over 90% effective. The safety profile was very good. The kids 5 to 11 had even less side effects than kids 16 to 25. The dose is smaller for kids 5 to 11 for the Pfizer vaccine. So these are all reasons that I would recommend getting kids vaccinated to have them, be more involved in all the things that kids need to be involved in, to be in school, to take part in sports, to be with their family and their friends. So we really want to basically protect the entire family by vaccinating our kids who are eligible now as well. And Lisa, if you have anything, to add as well, please.
That was great. I see another question in the chat that I don't think we covered, asking about materials for children about COVID-19 vaccines. We haven't really focused on that, real specifically, since they're mostly adult projects, but I think that those other resources that I mentioned previously that our partners are working on, they will probably be also adding a lot of resources that'll be targeted more toward children. So like Vaccinate Your Family, Voices for Vaccines, and Families Fighting Flu, and also CDC. So we can hopefully get some of those resources, links to those resources out to you afterward.
There was also one more question in the chat. With the regular vaccines covering protection for 6 months, now that we need a booster, how long will the booster give protection?
Oh, I think we answered that with another one, but I'll reiterate again, we're continuing to watch how long the boosters provide protection month after month, similar to the initial vaccines that someone received. So we don't know yet how long we are not able to predict if it's going to be another 6 months or a year, but scientists continue to watch that month after month.
And then we have another question, if we have time, Jenny, from Vanessa. If enough people are vaccinated, do you think we will reach herd immunity? I mean, we would love to reach herd immunity, but I guess time will tell how many people we can really convince to get fully vaccinated against COVID-19. It's these last, folks that have not been vaccinated seem to be hard to move on that. And so, yeah, I don't think anybody really knows whether or not we could get high enough coverage against COVID-19 to have herd immunity.
Wonderful. Thank you both so much for all of your great answering of those questions, which were fantastic, and of course for your wonderful presentation. Before we wrap up, we're going to include a link to a poll. If you don't mind answering those survey questions, we would appreciate it so much. And you can see now a quick slide showing some of our upcoming events. So we're really excited that all of the learning community members can attend some of these on social media, on equipping trusted managers, and on dealing with misinformation and fact-checking social media content. So we hope that you'll be able to join us for those. Thank you so much for those who are answering the poll. And I'd like to close us out by giving huge thanks again to our speakers, to my colleagues at the Urban Institute, and to the learning community members who have joined us today. Thank you so very much, and we hope to see you at our future events.
Thanks for having us.
Thank you.
Thank you so much.